I'm Dr. Andrew Satinsky. I'm the Medical Director of Radiation Oncology at MedStar Southern Maryland Hospital Center. We treat all kinds of adult cancers. We see predominantly breast cancer, prostate cancer, and cancers of the mouth and throat. But we also treat a wide variety, essentially all types of adult cancers that require radiation. My philosophy of care is that the patient comes first. We are an extremely patient-centered department. We have a full team of staff. All are licensed, certified, and have extensive experience in taking care of cancer patients. The point of the very first session, the consultation, is to get all the information we can from the patient, to determine what the treatment plan will be, to communicate it to the patient in a way that is completely understandable, to answer every question the patient may come in with and all the questions that come up during the conversation, and have the patient leave with a sense of exactly what we're going to be doing, exactly what to expect, and that they will be taken care of well. In terms of radiation oncology, where we are going in the future is with more and more specialized treatments, better ability to aim at a cancer and avoid the tissue around the cancer, which allows us to reduce side effects and increase effectiveness of treatment. At MedStar Southern Maryland Hospital, we have the state-of-the-art technology. We have a state-of-the-art linear accelerator, which we use to treat the common types of cancers. We have a machine called ZapX, which we use to treat tumors in the brain. That machine is the first of its kind on the East Coast, and it basically takes cutting-edge technology that ordinarily a patient would have to go into downtown Washington, D.C., or even further to get, and it brings it into the community. The most rewarding thing about my work, and the reason I keep coming back to work every day, and it's been more than 30 years that I've been doing this, is that every person is unique and different. The most important thing about a person is not the cancer they come in with, it is who they are as a person. Radiation therapy is a localized treatment, whereas chemotherapy is a systemic treatment. That means that chemotherapy has to somehow get into the bloodstream so that the bloodstream can carry it around throughout the body. Radiation is very carefully targeted to where the tumor is and the areas of concern. That means that the side effects related to radiation tend to be very localized, in contrast to chemotherapy, where we see problems like nausea and hair loss. The side effects with radiation tend to be related to the areas that we treat. For example, if we're treating breast cancer, we tend to see mostly changes with the skin. There may be some mild darkening of the skin or reddening of the skin. If we're treating something like prostate cancer, we tend to see side effects related to where the prostate is situated. For example, someone may urinate more frequently, or they may notice a little change with their bowel function. In general, the side effects are localized and very manageable. Radiation treatment is essentially an X-ray, and virtually everyone at some point has had an X-ray taken. whether it's a broken ankle or a scan of the chest or something like that. So people know that x-rays don't feel like anything. And the same is true of radiation. Radiation feels like nothing. There's no pain or burning or sensation with the treatment. Patients many times will be able to drive themselves here, have the treatment, and drive themselves home. For the most part, patients are not given a special diet. They're instructed to take their medication as usual. They're instructed to maintain their activity level, or sometimes we even suggest they increase their activity level. There are situations where, because of side effects, we may instruct a patient to take a special diet of one sort or another, but for the most part, this is something that doesn't have to change. It's a common misconception that cancer is never really eliminated from the body. All the various treatments do is postpone development of cancer elsewhere, postpone an inevitable bad outcome. The reality is that we cure many types of cancer, and we do this every single day. Breast cancer is commonly cured with a team approach. Prostate cancer is commonly cured. There are other cancers, even the stubborn ones, that we are still able to cure. So a patient can come in with some level of expectation that we will be able to help them and hopefully cure them. We have excellent technology, excellent tools available to us here at MedStar Southern Maryland Hospital Center. Honestly, it excites me every day when I come into the office. It excites me to think about the patients I'll be meeting, the old patients who I'll be seeing again, and the work we do to try to get rid of cancer. There are always advancements. There are advancements every year. I know that we're not going to be acquiring every single advancement, but we are always moving forward. We always have more to offer our patients. And at the end of the day, our real goal is not just to take care of the cancer, but take care of the person. A number of years ago, a collaborative effort was created to sort of unite all of the cancer programs within MedStar under one umbrella. And the designated name was MedStar Georgetown Cancer Institute. But it boils down to this. There is a virtually seamless connection between our centers. So if, for example, a patient comes into my office in Southern Maryland, and it is clear that they would benefit from an advanced technology, which we would have available at MedStar Georgetown University Hospital, it's a seamless process to move the patient from our center to that center, set them up for treatment there, and have them get what at that point is only available at an NCI designated cancer center like Georgetown's. Within MedStar, the radiation oncologists are all experts at treating all kinds of cancer with all kinds of technology. If you come in and, in my expert opinion, you would benefit from a referral to Georgetown to receive specialized treatment there, that referral will be made. But you can also rest assured that if I can treat you just as well in Southern Maryland, you can rest assured that we will take the best care of you.